Hello everyone, I'm Nikki Berryman. I'm Community Engagement and Employee Wellbeing Officer at Agilio. Thank you so much for joining us today for this really important webinar. And before we begin, we just want to take some time really to acknowledge that although working in healthcare can be incredibly rewarding, it can also be extremely challenging as well. The demands of this environment can take a real toll on employees' mental health, and it is vital that we talk about this openly. So today we're so pleased to welcome Alice Hendy, who is founder and CEO at Ripple Suicide Prevention. We're proud to help raise awareness of Ripple's really important work. We want to empower healthcare communities to take proactive steps in supporting their team's mental well-being. And the conversation today will no doubt be impactful, and I urge you to really listen with an open mind and an open heart. There's going to be some time for questions at the end. And so without further ado, let me hand you over to Alice.
Thanks very much, Nikki. And hello, everybody. Good afternoon. Really, really appreciate your time in joining us for this afternoon session. So as Nikki said, my name's Alice, and I'm going to be talking to you today about something very personal to me as we talk around the topic of mental health and suicide prevention. But I'd also like to go through with you today some tips, some pointers, some things really that you can keep in your back pocket for yourself, so that if you spot any of these signs in your loved ones or indeed your colleagues, you will know exactly how to act. So I'm going to start off by beginning really with my story. And if I can take you back to November of 2020, we are in the middle of the COVID pandemic. We are faced with lockdowns on a almost weekly basis. Lots of us are feeling isolated and lonely, and it's tough. It's a really tough time. For me personally at that stage, it wasn't great either. I had moved back home with my parents, and I was really trying to get back on my feet after a divorce. So I thought really for me at that time, life wasn't great. It can only get better, right? Little did I know that things were about to get an awful, awful lot worse. It was Wednesday, the 25th of November, 2020, and it was 5:28 in the morning at my parents' house, and we had a knock at the front door. Pretty relentless knock. I went over to the front door, opened it, and 2 police officers were stood in front of me. They asked to come in. They sat me down, gave us a glass of water, and very bluntly, they said to us, about 2 hours ago now, we found somebody who we believe has taken their own life, and we have identified that person as being your brother, Josh. Life for me at that point stopped. Life for my parents at that point stopped. The world stopped turning. It was almost like those 2 police officers had let a bomb off in the living room and then left for us to pick up the pieces. Words will never really be enough to describe that moment, to be honest with you. Josh was 21 years old when he decided he didn't want to be here anymore. He was my only sibling and he was my best friend. Now, what I do in my day job alongside my role at Ripple is I work in cybersecurity and IT for a large consultancy firm. Now, the reason I'm telling you that is because in the immediate aftermath of losing Josh to suicide, as his only sister and his older sister, I became absolutely obsessed with going through his devices. I went through his phone, his tablet, his laptop, every minute of every day and night for weeks and weeks. desperately trying to find out what was so bad in Josh's life that he believed that this was his best option. And when I did that, I found that for about 6 months prior to Josh making that decision that night, he had been going on the internet and he'd been searching for how he could end his life. And it was those searches that he was conducting. And this wasn't on the dark web. This is just standard Google searches, Bing searches that anybody can do. But it was those searches that actually were providing my brother with tips, encouragement to take his life, step-by-step instructions on how he could do it. He was even given pain scales for each method of suicide to help him make a decision as to what method he should pick. And it was Christmas Day of 2020, so exactly a month after we'd lost Josh, that I sat down with my parents in their living room and I just said to them, if somebody is that low and that desperate that they are conducting searches of this nature, why is there nothing out there that intervenes or interrupts that person at that pivotal moment of crisis to let them know that actually there's a more hopeful path and there is some amazing support services out there that they can access to get them through whatever it is they're going through? So because nothing existed, I decided to do something about it, and I created what now is called Ripple. You'll be able to see Ripple logo on the top right hand of the slide deck that you can see at the moment. And I'm going to be talking to you about Ripple, what it does, how it works, and showing you a demo as we move through our conversations together this afternoon. But I just wanted to point out a bit of a note really about that logo. You can see that it's called Ripple. And the reason for that is because on average, every time somebody takes their own life, 137 people are impacted. It's not just the immediate family, the mum, the dad, the brother, the sister, the son, the daughter. It's the milkman. It's the local shop assistant. It's the neighbour. It's the old school friends that you used to have. The impact is really far-reaching, and therefore there is a significant ripple effect here. You might also notice that the I in Ripple is spelt with a semicolon. You would not believe the number of people actually that email me and tell me that I've spelt Ripple wrong. But I can assure you it's very deliberate. The semicolon is and has recently risen as the international symbol of surviving suicide. If you use the semicolon in a sentence in the English language, it would indicate that the sentence isn't over and there's more to come. And in this context, what we're saying is your story isn't over. There's more to come from you. Keep going. Now, I wanted to just touch on a few statistics really here about the topic of suicide, just to show you the level really of issue that we're dealing with on this particular topic area. The biggest statistic here that really stands out to me is the first one. Suicide is the number one cause of death for men under the age of 50 in the UK. It's not cancer. It's not road traffic collisions. It's suicide. And that just blows my mind, really, the level here that we're dealing with. We also now know that 1 in 5 people have accessed websites which provide information on how to hurt or kill themselves. 13% of employees on an average business report thoughts of self-harm and suicide. Anybody can be impacted by this. Depression, anxiety, suicidal thoughts, they don't discriminate. It can happen to any one of us at any time. I also wanted to show you here a couple of statistics around the role that the internet plays in this. And you can see the top statistic here says that there are 1.2 million internet searches every single month around the world where people are searching for how they can take their life. If somebody wants to find the answer to something, the chances are they will now go on the internet in order to find it. And sadly, it's no different when it comes to the topic of self-harm and suicide. And now, in over a quarter of cases of suicide in under 20s, there is a suicide-related search history, just like my brother's. So what actually is Ripple, and how does it work? And how are we trying to combat those horrible statistics there that I've just shown you to try and make things more hopeful? Ripple is a piece of technology, and it can be downloaded in two different ways. The first way it can be downloaded is as a browser extension. So that means it can be placed on any browser that you work with. Now that could be Google Chrome, Microsoft Edge, Firefox, Safari, Opera. And once downloaded, if somebody was to then go online and search for content, harmful content relating to the topic of self-harm or suicide, the Ripple technology would intervene and interrupt that search and instead signpost that person to a selection of mental health resources that they can access both now and in the longer term. And I will show you a demo of exactly what that looks like in a moment. The second way that Ripple can be deployed and downloaded is through Wi-Fi. So we can put the Ripple technology on any Wi-Fi network at any location. And how that works, it would mean once on there, anyone connected to that Wi-Fi network, whether they're on their phone, on their tablet, on their laptop, whatever it is, if they're connected to that network and they search for something harmful, again, Ripple will intervene, interrupt, and signpost them to support services. So here's the demo. Hopefully you can all see this working. You can see I'm on Google and I'm typing in here how to take my own life. And once I do that, the Ripple tool comes up. I can't click off at this stage. I'm forced to pause and reflect and think about what it is I've just searched for. Once that breathing exercise has finished, you've then got the Ripple tool itself, which is presented. Now at the top, you've got the message of hope. And then underneath that, you've got three different tabs: talk to someone now, find continued support, and watch stories of hope. The Talk to Someone Now tab has the resources that are available immediately, 24 hours a day, for free for that person to access and utilize. The Find Continued Support tab has resources that are available to help that person manage their mental health on a more ongoing day-to-day basis. And the Watch Stories of Hope tab includes interactive video content from individuals who have gone through tough times and come out of it positively the other side. Every single component of this tool, from the rounded edges to the colours to the illustrations to the options that we've chosen here, have been based on research and evidence. We've worked with over 70 mental health charities, clinicians, lived experience panels, even professors in this field to help shape what Ripple is today. I wanted also to share with you here another reason really why I came up with this idea, and it relates back to Josh. I mentioned to you at the beginning of our time together that my brother was 21 when he made that decision. And I always joke and say, look, I was lucky actually when Josh was here, if I would receive a grunt over the telephone from him at the best of times, let alone expecting him to phone a helpline and to speak to a stranger and open up in detail about how he's feeling and his mental health. And so for Josh, that was never an option. What we've tried to do here at Ripple is provide individuals with a choice of how they would like to get mental health support. Now, that might well be over the telephone from the likes of NHS 111 or Samaritans, but it might also be through other means, such as the 24-hour text service provided by Shout, or Andy's Man Club, where individuals can actually go and join a group with other peers who might be going through something similar, or the Stay Alive app that they can download on their device, which is packed full of resources around this content and ideas on how they can stay safe. Or the Hub of Hope here, which has got localized services where you pop your postcode in and it will come up with all of the resources and groups and support that are available to you within your vicinity locally. However it is you would like to get mental health support is okay. The point is here that we're encouraging people to get it in the first instance. And that's often the biggest step. Ripple is also available in 49 countries and territories around the world in 14 different languages. So that means if I'm in Paris in France and I search for how to end my life in French, Ripple would be presented to me in French and it would signpost me to the resources that I need for support around my vicinity in Paris. Recently, we've also expanded out our protection so that we're not just interrupting harmful searches to do with self-harm and suicide, but actually we're also going into these different areas that you can see on the slide in front of you at the moment. Now, this doesn't mean that we are becoming organisation associated with each of these particular complex areas. The reason that we are expanding it out here is because every single one of these topic areas and life struggles have a direct link between somebody being more likely to go on to experience suicidal thoughts. Again, I'm going to use my brother here as an example. I had absolutely no idea about this until it was too late. But in the 6 days leading up to Josh ending his life, he had applied for over 72 payday loans. He was in financial trouble. He didn't tell us. We had no idea whatsoever what he was going through with his debt. If he had, we'd have been able to work out a plan to get him out of it. Absolutely. I have no doubt that Josh's finances played a role in him making that decision on the 25th of November, 2020. So how this works, if I give you an example on alcohol here, if I search for how do I hide alcohol on my breath at work, Ripple would come up, but it would signpost me to alcohol-related support services. However, if I search for what time does the pub open tonight, it wouldn't, because that isn't classified and classed as a crisis level search. The idea here is that we are intervening and interrupting harmful searches at an earlier stage and signposting somebody to bespoke support related to that search to get them the help that they need before it gets to the stage of self-harm and suicide. Who is Ripple aimed towards? This really is a tool for everybody. I'm talking to you today as colleagues at Agilio, but I'm also talking to you today as people, as family members, as mums, as dads, as brothers, as sisters, as daughters, as sons. This is also for you to download at home, and it's completely free to do so. I will pop in the link to actually download Ripple. It takes 60 seconds to do. And I've tested this on my mother, And I can honestly tell you that if she can download this tool in 60 seconds, there's hope for everybody. So it really is a simple process, and I will send you the link so that you can have a go yourself. But it's free for you to download at home, either for yourself or indeed for your loved ones, children, and so on. This is also completely free for schools. It's free for colleges. It's free for universities, and it's free for other charities as well. And we've got hundreds and hundreds of schools, colleges, universities, and charities that have already taken us up on that offer. Ripple is also available for businesses to deploy as well, to safeguard their workforce. And Agilio is one of those businesses who have signed up and really got behind the tool and what it stands for in order to safeguard their workforce and let them know really that they care and that they are there for them in that moment of crisis. And as I mentioned earlier, it's also available at all venues, anywhere at all that's got a Wi-Fi network. We are able to put Ripple on there to support them with whatever it is they're going through. Here are a further list of individuals and organisations who have already deployed Ripple successfully across their organisation. And you can see here there's a real mixture. We've got football clubs, Compare the Market, insurers, Network Rail have got this on their biggest train stations up and down the country, NHS organisations, legal firms. I've even got a waste disposal unit on here, believe it or not, that have deployed Ripple. So it really is for anybody and any organisation, however big and however small. We've now won 37 awards in mental health, innovation, tech for good since we launched Ripple on the 10th of September 2021, World Suicide Prevention Day. And really, this isn't for backslaps, right? However, when we do go to these award ceremonies and we win, often some of the big organisations, and many of them actually are on this slide, they often wonder who we are and what we do. And that helps us to get the word out there around the work that we do and ultimately to save more lives. We're also regulars on mainstream media, television and radio. You can have a look yourselves at all of the media appearances and comments that we've made on our website, but also on our YouTube channel as well. They're all uploaded onto there. Before I go into the impact here, I also just wanted to have a brief mention here on data privacy, because it's a really common question that I get asked around Ripple. Ripple does not track, monitor, collect any personally identifiable information whatsoever. So that means if John, based in the finance department, was to search for something harmful, we would not be able to see John's data and then send that to HR and report back. We're simply not allowed to do it, and we don't have that data. But what we can do is interrupt John at that pivotal moment, which sometimes is all it needs, to actually let him know about the amazing support services that exist for him. Since we launched in 21, we now have just under 2 million weekly active users of the Ripple technology around the world. We've now successfully intercepted on over 120,000 harmful online searches to date. And just to be really clear, these aren't searches where people are typing in mental health or well-being. These are searches where people simply don't want to be here anymore. They are crisis level searches. And even though we don't track or monitor any personally identifiable information at all, we have now been approached by 32 individuals directly to tell us that they are still here because Ripple intervened at their most vulnerable point. And if I'm being completely honest with you, it's that figure and that number that keeps me going and gets me up each morning. Because that's potentially 32 people there that don't feel like my brother and are now getting the support that they need. And potentially 32 sisters that don't get up in the morning, open their eyes, and feel like me. So it really is a statistic which astounds me since I started this Ripple as an idea, that we could have made that much impact, and hopefully long may that continue. I mentioned earlier to you as well the global reach of Ripple. It's now in 14 languages in 49 countries and territories around the world, and we are constantly expanding this so that we are hopefully going to turn the whole world light purple at some stage. Okay, so that was the first part, if you like, of my presentation, where I wanted to share with you my own personal story, but also the introduction of Ripple, and what it is and how it works. So hopefully you found that useful. But we've still got some time together, and I wanted to make sure that I share with you really some top tips around how you can actually use different language, which might make an impact in your conversations that you have on a daily basis. It might bust myths. You might have heard some of these myths before. But also around some of the signs that you might be able to look out for in your loved ones as well, that you can take away with you. So you can see on the slide in front of you here, I wanted just to give you 3 examples of language and how important this is. Now, this is not a telling off or a preaching exercise, because if I'm being completely honest with you, I would have probably said these things myself. Excuse the schnauzers in the background, everybody. Before Josh made that decision, I would absolutely have said these words, these phrases, these statements, and not really have thought anything about it. But here's why it's so important. So you might have heard before somebody saying they've successfully taken their own life, or they had a successful or unsuccessful suicide attempt. Now, if somebody actually dies by suicide, that is far from a success. So if you think about it logically, it's actually very inappropriate, because it frames the outcome almost as an achievement, and it isn't. So instead, use language such as lived through a suicide attempt. If somebody comes to you and is struggling and is talking about how they're finding things difficult, sometimes people would come back and say, well, other people have got it a lot worse. You know, you've got a car, you've got a nice house, you've got a great family, you've got a good job, you've got money. Great. Other people have got it a lot worse than you. It doesn't matter actually what you have. It's what actually is going on inside your head that is important. And if you look at some examples of people that have taken their own life, that would be seen as somebody who perhaps you'd think, well, they've got it, but somebody else has got it a lot worse than them. Robin Williams is a good example of that. Comedian, great family, lots of money, doing really well. He ended up taking his own life. So it doesn't matter what you've got or materialistic items. It's what goes on in your head that's important here. So validate them. Tell me more about how you're feeling is something which would be much more appropriate to say to somebody if they're finding things difficult. Similarly, how could you be so selfish? This one I struggle with. People have said to me, Josh, I can't believe he did that. That was so selfish of him to do that, to take his life. Actually, if you think about it again logically, Josh believed and honestly thought that he was a burden. And he believed that by taking his life, he was doing us a favor because he was no longer here anymore. So in actual fact, it's probably the most least selfish act that you could think of, because actually he was thinking about others the whole way through. People who are suicidal and struggling with suicidal thoughts often assume that the world is better without them. And it isn't. It's better with you. And so we need to validate their feelings, but also just bear in mind that when people do make attempts to take their life, it is not selfish. They are not well. A couple of myths for you. The big one here for me actually is myth number 2. If I talk about suicide to someone, it might put the idea in their head. That's the biggest one for me, myth-wise, and you will often see that all over the internet if you were to search for that. Actually, if you think somebody's finding things difficult and you approach them and ask them directly, are you thinking about suicide? Are you having thoughts of suicide? Quite often, you will find that that person you're asking that question to feels utter relief that you've asked them, because it opens up that doorway of communication where they can then actually talk about how they might be feeling. It does not put the idea in their head. It's actually the complete opposite. It allows them to open up and have that dialogue with you. Now, that's tough. To ask somebody directly if they're experiencing thoughts of suicide is really, really tough to do. But sometimes it's necessary. And I would urge you, if you've got anybody within your circle, whether it be at work, at home, at a club, whatever it is, please, please, if you're seriously thinking that they might be finding things this difficult, ask them directly that question. And I've also got another one here, myth number 3. People who say they're suicidal are attention seeking. They're doing it for attention. I can't stress to you enough how important it is if somebody has that courage to open up and tell you that they are feeling suicidal. You must take it seriously every single time, no matter how many times they've told you, because it takes a huge amount of courage for that person to actually open up and explain and talk about the feelings that they might be going through. So please, please validate them, take them seriously, and make sure that you give them the time that they need to talk about what it is they're going through. Now, I've also got here signs. I think before I go into this, it's really, really important to say that sometimes there are no signs at all. It really does vary from person to person. So I'm going to go through these signs of suicide, but please just bear that in mind that sometimes there are none at all. I'm going to use Josh as a bit of an example again here in terms of signs that perhaps he was displaying. I had absolutely no idea that they were potentially signs that he was struggling. None at all. So I'm trying to really use my experience and my learns to help you so that you don't ever end up like me or feeling like me. Now, Josh and me like our food. We always have done. And I didn't really think anything of my brother putting on weight, if I'm honest with you. I just thought he was eating too much fast food like we both always have done. However, he was not looking after himself. And the amount of weight that he was putting on over a fairly short period of time was absolutely a potential sign there that he wasn't looking after himself and that he was obviously gaining a huge amount of weight. He also showed a lack of hygiene, which was never really a thing for Josh. Josh was always so well-dressed, smart, showered every day, smelt good, did his hair perfectly with his gel. So when he got in my car a few weeks before taking his life and he smelt, that was a sign. He'd lost all interest in his appearance. He'd lost interest in taking care of himself and of his personal hygiene. And that wasn't because he didn't want to. It was because he couldn't. He was getting up in the morning and he felt like that goal of getting in the shower was unobtainable. And unfortunately, that is the case for a lot of people. They struggle with how they're feeling, and staying in bed, just getting out of bed, is a big enough challenge for them, let alone expecting them to go and wash or get dressed and shower. You've also got a change in sleeping patterns here under the behavioural markers. Josh would regularly text me at 2 o'clock, 3 o'clock in the morning. I just assumed he was out enjoying himself. He wasn't. He was sleeping in the day and he was awake all night, most nights. That's a sign. Changes in sleeping patterns. Financial difficulties I've touched on already. They might be going through financial difficulties, but also relationship problems as well. They might have broken up with their partner, boyfriend, girlfriend, husband, wife, whatever. That might be a bit of a factor of a behaviour that might indicate a sign that someone's struggling. And giving away of possessions. Josh was selling his iPhone, his Xbox, his games. He was selling them all. Not normal behaviour from somebody who usually enjoys those kinds of things. So these are all signs of suicide, and I've put them into 4 different sections here. Please do have a look at them in more detail in your own time. And as I said at the beginning, please also bear in mind that sometimes there are none at all. Top tips for you under really 3 headings which are crucially important: listen, trust, and care. Listening is by far the biggest. If somebody approaches you and wants to talk to you about how they're feeling, spend more time listening than talking. Don't interrupt them. Allow them to have that space to talk about how they're feeling. Give them your undivided attention. Nothing else matters at that stage apart from your focus on that person. Don't force advice or your opinions. You just need to validate them. Whatever they're feeling, whatever they're going through is valid and is okay. But at the same time, don't pity or patronize them either. And avoid changing the subject. As hard as it is, nobody wants to sit and talk to somebody that they love about suicidal thoughts. But as hard as it is, it does need to happen if somebody is finding it that difficult. And it could be the conversation that saves a life. Trust them. Make sure that you're showing them respect. They've obviously shown a huge amount of courage to come forward and actually tell you how they're feeling. Treat everything in confidence unless it's a crisis situation and you believe that this person is potentially at risk of harming themselves or others. Don't leave them alone if you believe that this person is an active risk of suicide. And try to be as calm and as considered as possible. Again, easier said than done. When somebody tells you they're suicidal, inside you're probably panicking. But actually trying to be calm, providing that level of reassurance, accepting what they're saying, validating what they're saying is the best thing that you can do. So I hope that was useful. Nikki and the team have got my slides that hopefully they can share out with you at a later date so that you can have a look at this in your own time, but also come back to it if you need it. And we've now got a bit of time, I believe, for some Q&A. So on that note, I'm going to hand back over to Nikki. But thank you so much, everybody, for listening to my story this afternoon, especially probably during your lunch hour. Thank you.
Thank you, Alice. So everyone, before we lose Alice for the afternoon, does anybody have any questions? You can pop them in the chat there. Any questions you have about Ripple or how to go about getting it installed in your practice, please fire away. The purpose of this webinar really was to help support your practice teams. Also, this is something that you can use at home with your family and friends, but certainly in the workplace. Getting Ripple installed in your practice would be a really important next step. So any questions? So just to say, everybody, these conversations are never easy. We know that, but they're absolutely vital, especially in the healthcare space. we hope today has sparked a bit of thought and reflection. Can I ask that you all take some time to talk to your colleagues in practice, your practice manager, the practice owner, and maybe share this webinar recording at your next practice meeting would be really powerful. And think about the steps that you're going to take in your practice to ensure how you are supporting your team members. Alice, Estelle is asking, is there any information available to give to a school, please?
Yeah, great question. Thanks, Estelle. There is. I'm just going to put. I'm going to send you a link when it works properly in a moment. On our website, there's a section of downloads, and on there we've got one-pagers for schools and colleges and universities. We've also got a template letter, which includes wording that you're able to use in order to approach the school, the college, or the university, to let them know that Ripple exists, what it is, and to encourage them to make contact with us, because we're here, we will help them deploy it for free within their establishment, and we're there every step of the way to make that happen, to safeguard their students and young people. So it's on the download section of our website, so please do have a look there.
Thanks, Alice. Louise is asking, will the recording be emailed to us? Possibly, Louise, yes. If not, you will be told where you can access it. So yeah, you'll be able to access it really easily. So don't worry, we'll let you know where. Sandy's asking, I really like the idea of connecting Ripple to our Wi-Fi. How would we be able to arrange that, Alice?
Thanks, Sandy. So if you email me, what we can do is have a conversation with you about how many access points or routers that you've got in your practice. And we work directly with the IT person in your practice in order to make it happen. Heathrow Airport have got it on their Wi-Fi. Manchester Airport have got it on their Wi-Fi. We've got big football stadiums that have got it. Wembley have just signed a contract with me to actually put this in their huge football stadium when England play. So it really is a straightforward process, and we take away all of the kind of tech jargon from you that you'll have to, so that you don't have to have a look at any of that. We take that away, and it's an easy process. But once on, it means that if somebody was to connect to that Wi-Fi, be that anybody at your practice or any, patients, people, customers that come in, if they were to search for something harmful, then Ripple would be presented for them. I'm just going to put in my email address in the chat, and if you drop me an email, we can have a conversation and make it happen.
Thank you, Alice. Actually, that's a really good point that that I didn't quite realise myself. Of course, if it's on the Wi-Fi, then patients in practice will be protected as well. So that's a really great thing to think about. Okay. Michelle is asking, what is the cost for subscription in the workplace? And I think, Michelle, if you just reach out directly to Ripple, they'll be able to help you with that, because it depends very much on Wi-Fi access, that kind of thing. So if you just email them directly. Let's have a look. Samantha, thank you for your question. Do you have any printouts we can put up in our practice notice board?
Yeah, that's a good one. Yeah, do you know, I do actually. So we've got one resource, which again is on the download element of our website, and it's signage that we've created. And you might see, obviously, around workplaces, lots of they have to have kind of fire safety signs all around the building by law. But what we've done is we've recreated the fire safety sign into a suicide safety sign. So it looks similar, but it's around the topic of suicide. And the reason for that is somebody is actually over 70 times more likely to die by suicide than they are in a fire. And so that link that I've just posted in the chat will take you directly to that sign. You can download it yourselves, or we actually have loads of A5 copies card copies of that you can put around the office as well. So if you did want any of those, we'd be very happy to send them to you. Again, just drop me an email and we can get them sent over.
Fantastic. Thank you. Adele Francois says, thank you very much, Alice. I will be giving the Ripple details to my NHS trust. Thank you. That's great. Thank you so much. Just have a look. Christy says, thank you so much for sharing your experience. This is a wonderful tool and I'd love to hear about costing. So Christy, same message really, just email Alice, email Ripple, and they will come back to you directly very quickly with some costings. Luke, that's great to know. So Luke Hazeldine saying Vets One are taking the Ripple tool via Wi-Fi. Details to be finalised soon. Fantastic. Thank you for sharing that. That's really great. Samantha Pritchard is saying, thank you very much for sharing your story. I will certainly spread the word about Ripple.
I just wanted also to just cover Decky. Hopefully I'm pronouncing your name right. Firstly, I'm really sorry for your loss. I know how you feel. Secondly, there were signs you tried to get help for her, but mental health services are inundated and didn't see her as a priority. Sadly, we are seeing that only too often, that wait times and so on for services, help, support are just horrendous. We're really in a pretty dire situation with it, to be honest with you. So what I tend to do when people are finding waiting times to be a problem is really just signpost to some of the amazing other resources that exist that are often free, that people can access now, immediately. And I've created a document here with my team that I've just put the link in the chat that contains loads and loads and loads of resources on there, from apps to groups to helplines to tech services to web chats. There's loads on there. But what I will also say, Decky, is there's a great resource that you might find useful after your loss and that your family might find useful, which is called Suicide & Co. And they are a bereavement counselling support service. I've just put the name in the chat. I've been through it now twice, completely free, and they offer you counselling services for people if you've been specifically bereaved by suicide, because losing somebody to natural causes is very different to losing somebody by suicide. There's lots of increased emotions around the loss. So I'd really recommend having a look at them and seeing if it might be something your family might be interested in. And another one, if you've been bereaved by suicide, is called SOBS, which stands for Survivors of Bereaved by Suicide. And they offer groups with people like us who are in that boat, who get it, and who can talk about how we're feeling in a safe space. So I hope that's helpful.
Thanks, Alice. So a lot of people are thanking you for joining us today, and a lot of people are saying they're going to share the Ripple demo on their social media. So fantastic. The more you share this story, everyone, the more awareness we create. So please do share Ripple with everybody. Do we have any more questions before we close today? Nope. Okay. Well, that's it for today. Thank you, everyone, for joining us. Take care of yourselves. Share the message far and wide, and have a good afternoon. Thank you.